So after I retired from the Navy, we were up in Chicago. My wife's from San Diego. We had to decide if she wanted to endure any more Chicago winters. To me, that was just what I knew growing up, and we had lived all over the country. So I had a chance to purchase a practice up there with a doctor I was working with part-time, but she wasn't going to deal with the 6-month winters. So we started looking around for places to go, and so we were looking between like Sarasota, Houston, Athens, Georgia, Knoxville, Tennessee. And so I started looking around, and my wife and I was sent to a Siesta Key during a gymnastics meet for my daughter in Tampa, and they fell in love with the area. And I started looking around for practices to apply and try to either buy or to partner up with out here. And I happened to come across Dr. Chasolen, this practice online, and I contacted him, and we hit it off from the get-go. Came down, did 2 meetings with him, one with just me and him and his wife, and then I brought my wife down. We had dinner, and we just seemed to have the same philosophy. The mentors I had in the Navy were very stringent with what they wanted and what their expectations were, and I think at the time they grew up in a different time where it was very matter of fact, and they just kind of told you how it was, and people wouldn't worry about getting your feelings hurt. And so I appreciated that. I wanted that feedback. And maybe it was my background. I was used to this. Talking with Dr. Chasolen, it seemed to me when I first met him, and it's been true, is that he has the highest standards, and it aligned exactly with what I wanted to do. I wanted to put out good. I want to do excellent work for my patients. I want something that they're proud of and I'm proud of. I tell them when I'm finishing up and polishing at the end that the last bit of it is for me so that I can sleep soundly at night. I have probably a problem, but it's good for the patient, is that I will replay the day at the end of the day at night when I wake up in the morning and think about all the things I did and if I could have done anything better. And that's what drove me to this. And so immediately meeting Dr. Chasolen, seeing his work, he is prolific on posting online at times in some of the dental communities. It was fantastic to see something like that. And then being an educator was a fantastic bonus. I wanted to find someone that I could learn from, and he does. He teaches me things every day. It's fantastic working here and learning something new or something different, or how to tweak this little procedure to make it even better for my patients.